Welcome to OncoLife interview session. It's my pleasure to introduce our guest today, Dr. Joana Reis, Global Medical Affairs Lead, Breast Imaging, Radiology at Bayer. Thank you very much for joining us, Dr. Joana.
Thank you, Sain. Thank you very much for having me.
From dense breast to early diagnosis, today we are focusing on how AI innovation are transforming breast cancer screening and early detection. Breast cancer is the most common cancer in women, affecting millions each year. Early detection is critical, but challenges such as dense breast tissue continue to hinder accurate and timely diagnosis. So we can start with some information about your background and professional journey.
Sure, thank you, Sain. So as you mentioned, my name is Joana Reis. I'm currently the Global Medical Affairs Breast Lead for Radiology at Bayer, a role that I started on January 1st. I have previously served also at Bayer as a Global Medical Affairs Lead for digital radiology, so where my experience included developing and implementing global medical strategies with a focus of AI applications in imaging and fostering collaborations in healthcare innovations. Before joining Bayer, a little over 2 years, I worked as a senior consultant breast radiology at Akershus University Hospital in Norway, where I worked both in clinical and screening settings, and I hold a PhD in breast MRI and local advanced breast cancer patients, also from University of Oslo. So taking everything in consideration, my passion lies in integrating cutting-edge technology with clinical practice to improve patient outcomes in breast health.
Thank you. So we may move the main part of the interview. And could you provide an overview of the breast cancer, the current landscape of the screening and the critical role of the early diagnosis play in improving outcomes from a radiologist perspective?
Sure, and as you already mentioned, so breast cancer is the second most common cancer overall, but is the most common cancer in humans, so impacting around 2.3 million humans worldwide each year. And this contributed nearly to 12% of all new cancer cases, with around 700,000 deaths per year. So yes, it is true that treatment can be highly effective, but especially when the disease is identified early. So according to the American Cancer Society, when breast cancer is detected early, and when it is detected in the localized stage, the 5-year relative survival rate is around 99%. It's also important to remember that not all breast cancers form a lump you can feel. So breast cancer is sometimes found after symptoms appear, but many humans with breast cancer have no symptoms at all. So this is why regular breast cancer screening is so important. So all these national breast cancer screenings. Improvements in survival began in the 80s in countries with early detection programs combined with different modes of treatments. It's also true, and is important to say, that impressive medical progress in breast cancer has been achieved. But it's also important to remember that, however, the impact this devastating disease has on society is still enormous and is still staggering. At Bayer, especially in the area I'm working in radiology, we are committed to supporting the fight against breast cancer and driving advances, especially in the early detection.
Early detection is key to improve the breast cancer outcomes. What are the most promising innovation currently being explored to enhance the accuracy and efficacy of the breast cancer diagnosis?
You are completely right. So early detection is crucial, is vital for improving breast cancer outcomes. And there are several promising innovations currently being explored. So one of the most significant investments is the integration of AI in imaging, the integration of artificial intelligence imaging. AI algorithms can assist radiology, not only radiology, many of the healthcare professionals, by quickly analyzing mammograms and identifying abnormalities which enhance diagnostic accuracy, especially in dense breast tissue. Additionally, we have the 3D mammography, also called tomosynthesis, that provides a more detailed view of breast tissue when compared to the traditional offer that is a 2D mammography. And we're using tomosynthesis, so we reduce the likelihood of overlapping tissue that are obscuring tumors. We also have the contrast-enhanced mammography, CEM. It is another innovative approach that combines traditional mammography with contrast agents, so improving the detection of cancers. We have the breast MRI, and the use of breast MRI is increasingly used as a supplemental screening tool, special for high-risk human due to its high sensitivity. I would like to mention that in a recent study at Bayer, to better understand needs in this regard, we found that only 39% of humans were familiar with high breast density as a breast cancer risk factors. We also can have as advancements as genetic risk assessments. That has also been playing a vital role in stratifying patients and personalizing screening protocols based on hereditary mutations. And to finalize my answer, we can also add the patient-centric screening programs that utilize both AI and the risk assessments. And together, they enable a tailored screening schedules, enhancing early detection efforts.
Dense breast tissue can mask cancer during the standard mammography, presenting unique challenge for the early detection of the breast cancer. How can artificial intelligence assist radiologists in overcoming these difficulties, particularly in identifying the cancer that might be obscured on mammograms?
Indeed. And to give some more background, for humans with risk factors, such as you mentioned, dense breasts, there is mounting scientific evidence that standard mammography, so in other words, a 2D mammography, might not be enough. Humans with extremely dense breast tissue have about 2 times more the risk to develop a breast cancer than average human. And at the same time, for humans with dense breasts, the sensitivity of mammography is reduced because cancers can be masked. So this is why a recent published regulation by the FDA requires mammography facilities to notify patients about the density of their breasts. AI algorithms can assist in both the acquisition and interpretation of mammographic imagings. We can utilize 2D and 3D, 2D more in Europe and the 3D tomosynthesis more used in US. AI can quickly detect abnormalities that may miss by a human eye, thereby improving diagnostic accuracy. I also would like to add that there are already density assessment solutions commercially available that simplify and can also standardize breast density reporting and stratifications, providing accurate and reliable results. And this will enable clinicians to proactively implement personalized screening plans for humans, especially the ones with dense breasts. AI can also streamline workflow by automatic routine tasks, such as lesion measurements and report generation. So this allows radiology to focus on more complex cases that requires their expertise and, of course, ultimately enhancing efficiency in clinical practice.
Another big problem in the breast cancer diagnosis is long waiting times for diagnosis, and heavy clinicians' workloads are a big challenge in radiology. What innovation are helping to address this issue and improve patient care? How can technology, including AI, reduce burnout and boost efficacy and with significant diagnosis quality?
Indeed. With all the challenges, radiology practices are extremely under pressure. And we can counter these with different measures. of which one of them can be artificial intelligence, can be AI. As I mentioned before, all these AI applications are designed to support radiologists in their increasingly demanding daily tasks. So they hold promising to help tackle the growing workload. For example, AI can assist radiology by quickly detecting abnormalities, by automating routine tasks, and by enhancing imaging quality assurance. Once again, this allows radiologists to focus on complex cases and reduce the pressure associated with high case volumes. Additional workflow optimization tools, so the new, more recent workflow optimizations AI applications can help manage schedule and resource allocation, so ensure that not only radiology, but as well as the technicians, the radiographers, work more efficiently together. So these advancements not only aim to improve patient care, but also address clinician burnout by reducing administrative burdens and enhance job satisfaction.
With AI enhanced tool, what improvements have been observed in early detection rates and the patient outcomes, particularly for the high-risk group as a woman with extremely dense breast tissue?
With AI being a relatively new field, we see encouraging proof points that the combination of human readers and AI, the potential to improve screening performance, especially as you mentioned on your questions, among women with dense breasts. One key example are the density assessment solutions, which simplify and standardize breast density reporting. Using both 2D and 3D images, it examines the human breast anatomy and delivers unique patient-specific breast density assessments. As I mentioned before, more recently, there are risk solutions that have the potential to personalize risk assessment based on age and other clinical features and imaging evidence directly from mammograms. So we'll deliver actionable information about the probability of developing breast cancer in the next years. And this will empower both patients and care providers to design tailored care plans. There are already several publications available that can prove and substantiate this claim. So, including one published in Nature, I believe in 2020, that demonstrates that an AI algorithm for mammography screening could reduce false positives by around 6% and false negatives by around 10% compared to human radiologists. So this study and these results indicate improved diagnostic accuracy, particularly for women with dense breasts. Another multi-center study, this one published in European Radiology and in 2021, reported that the implementation of AI tools to assist with imaging analysis and workflow management led to a 30% reduction in reading times for radiologists. So these improvements allowed for increased production rates and reduced patient wait times for diagnosis. I would like, for instance, just to finish my answers, to add the Mosaic trial. So a very important large-scale Swedish study published in 2023 in the Lancet. So using an AI algorithm, they were able to increase the breast cancer detection rate by 20% compared to traditional methods, also leading to reduce the number of diagnostic errors. So in other words, they can also reduce the number of false positives. And yet at the same time, the Mosaic trial also demonstrated the clinical safety and efficacy of AI in mammography screening.
How by utilizing the artificial intelligence in radiology to improve the diagnostic accuracy and speed, particularly in breast cancer screening?
With its potential to support better diagnosis and improve efficiency, AI in radiology is a focus for us, is a focus of Bayer's activity in this field, in the breast field. So, for example, we offering a vendor-neutral platform an AI app store that coordinate various third-party application solutions into a single convenient cloud-based marketplace. So vetted and curated with buyers' expertise to ensure the feasibility and reliability of the applications offered. This platform, the buyer's platform, streamlines the deployment of AI tools, enhancing diagnostic accuracy and efficiency. Into more detail regarding this platform, so it is orchestrated in service lines, focus on specific body regions and diagnostic procedures. For example, we have the thoracic service line, the neural service line, the MSK service line. And breast imaging specifically for this interview is an area we are currently looking into expand our offering and are collaborating with app developers around breast imaging in this regard. In addition to this platform, we also have the Buyer's new AI innovation platform, a cloud-based end-to-end software development platform designed to streamline and to accelerate the development, to accelerate the validation and the deployment of imaging-based AI and machine learning healthcare applications. And there was, this one was built on the Google Cloud technology, which is in an external testing.
Implementing artificial intelligence in clinical setting can be challenging. What are the main obstacles you have encountered, and how is Bayer addressing this to ensure widespread adoption of AI-driven radiology tools?
That's a great question. I believe there are three main constraints or three main domains when implementing AI in practice. So first, finance. Second, target groups, and third, the technical aspects. So starting by the finance one. So from a financial standpoint, it is essential to demonstrate the return of investments, the ROI, that an AI tool or system or software can deliver to the hospital, to the department, or to the healthcare system where it will be implemented. Second, there are concerns among healthcare professionals and administrators who will be using and integrating this technology. A significant barrier is that some professionals still perceive AI tools as a threat to their professional identity and expertise. Additionally, many healthcare professionals may not fully understand how to evaluate the various AI options, the various AI applications available, and how these tools will impact their daily routines and their clinical workflows. And the third constraint that I mentioned regarding the technical aspects, there must be clear evidence of the efficiency and performance of the technology, particularly the algorithms indications, as well as how user-friendly it is. The current AI landscape is scattered, with mostly isolated solutions that are not integrated into existing workflows. So this means that radiologists must shift between systems, between platforms, applications, and thereby disrupting the standard workflow, their clinical workflow. I can also mention other prominent barriers such are regulatory compliance, data privacy, cybersecurity, and AI training buyers. Our digital buyer platform, the one that I mentioned in the previous answer, counters this by giving simplified and access to a growing number of high-quality applications for clinical imaging and workflows, including AI solutions that provide reliable support, ensuring that radiology can adopt these tools without disrupting their daily routines. In relation to data security, Bayer takes this topic very seriously. We implement specific technical measurements to secure the data, applying strict guidelines on how to use the patient data involved in line with all applicable data protection laws and applicable regulatory guidelines. So I really believe that addressing these constraints is crucial for a successful integration of AI into clinical practice.
Well, we are on the last question. And what is the Bayer's long-term vision for AI in radiology? How do you see AI evolving in the next decade to further enhance breast cancer screening and oral cancer care?
So Bayer's long-term vision for AI radiology is centered around transforming healthcare through advanced technologies. We have over 100 years of experience in diagnostic and therapeutic innovation. So Bayer is committed to shaping the future of diagnostics by harnessing the power of AI, artificial intelligence, for the benefit of not only the healthcare professional, but as well as the patient. As the science advances, our focus will be on identifying clinical relevant cancers earlier and differentiating them from benign lesions, so thereby minimizing unnecessary follow-ups and tissue sampling. We envision AI as a key enabler for a more personalized and proactive approach to breast cancer screening and overall cancer care, from prostate to lung, for example. In the next decade, we anticipate that AI algorithms will become increasingly sophisticated, so will allow us for more detailed interpretation of imaging studies. It's also important to mention that AI will also play a vital role in integrating multimodal data, so from imaging, from radiology, but pathology and genetic information, so to provide a more comprehensive risk assessment and personalized treatment plans. To wrap up, as AI technology evolves, we foresee them contributing to ongoing patient monitoring and management, so facilitating remote monitoring and providing real-time insights to healthcare providers. So this will enable timely interventions and ultimately lead to improved patient outcomes.
Thank you, Dr. Joana Reis. I have finished all my questions, and I don't know, do you want to add anything else or underline any important topics in this interview?
I would start by saying thank you very much for having me here today. It was a big pleasure. And it was very important for me to share my perspective on breast cancer and to discuss the latest advancements on the field of radiology, particularly in highlighting and enhancing the transformative potential of AI in improving early detection and patient care.
Thank you very much to sharing this insight and your expertise with us.
Thank you.